Surgery. It's something I thought I would have gotten years ago due to the amount of sports I've played or how reckless I was. I always loved pushing my body to see what I can achieve and accomplish. I've fallen off bikes while trying to perform tricks or going mountain biking, dislocated both shoulders, damaged my knees, ankles, ribs, and the list goes on. I remember when parkour used to be a big thing, and my buddies and I would actually climb on top of roofs and just jump from one side to the other. It was quite interesting, very scary. I would not recommend it, so please don't do it. But when it happened in the past, I felt like I was Wolverine from X-Men. Quick healer, but I just didn't have the hair or claw. The surgery I'm about to have is a hip arthroscope. This is when they make a small incisions in the hip, about 1 centimeter. Use a camera and surgical tools to do the procedure. Like all surgeries, there are risks. With this, I can experience numbness in the groin and top of my foot, but should go away after a few weeks. It is possible that it can become permanent. So all I could ask is send positive vibes, comments below, subscribe, and share. The surgery will repair a torn hip labral. This is where the cartilage in the hip socket begins to tear. It will also repair a cam, which is the extra bone growth from the femoral head, and also a pincer, which is extra bone growth on the hip socket. And I also have a couple of cysts that was found during the ultrasound. Despite all of this, I was close to getting a hip replacement if this wasn't caught, because the cartilage could have disappeared in my hip socket, which would have the femur, which is the biggest bone in the body, and my hip socket grinding with each other. And that, my friends, would have been very painful. So I'm quite glad. With all of this, I have been experiencing pain in my hip for the past 2 years. Some days the pain is unbearable, especially when doing simple motions such as sitting or walking. I think the past 2 years I had a total of about a month of no pain. I actually felt like Superman. I actually felt like Wolverine. The biggest indicator for me when I knew I should go to the doctor and keep being adamant about it was when I lost my range of motion and had a stiff hip. Usually you are able to raise your knee to your chest, but when doing squats or stretches with my leg, my right leg to be exact, it would automatically start to move outwards away from my shoulder. When it first happened, I was like, that's not good. It's a little strange. I should really check in to the doctors and see what's going on. Then when I forced it to go straight, I had an automatic pain shoot through my hip, right up my hip, and then my lower back as well. And literally I just felt a tingle. And from there, like as soon as I start forcing it, it just automatic pain, and I was down for the count. I couldn't move. I couldn't lift up my leg after that. I've been going to the doctors, specialists, and physio for the past 2 years. I have done, I would believe, every test under the sun that the doctors and hospital could actually do. I've done MRI, ultrasound, X-rays, did some EKG. There's like electrical static thing that they did. It was pretty cool, but quite scary. I swear, like the most scariest thing for me is doing MRIs because it gets, especially on the leg or like any part of your body. Well, really just the leg for me when I did mine, and also the shoulder, is that you get so close to the very top when you're going inside the MRI. I swear all I do is just like close my eyes and just like fall asleep. Because like I'm just like, it feels like I'm in a coffin. So during those times, it was actually quite interesting. At one hospital I went to, I saw advanced technology at its best. They actually were testing a futuristic robot instrument. The doctor actually had a remote control and he was like swiveling around the arms. They had a little camera for it as well, which was projected on a big screen, and it was actually doing surgery. So it was quite interesting to see all that, to see the advancement of technology and see how far humans have gone on, especially with the healthcare system. In my previous podcasts, I stated I'm a baseball fan. I remember watching Edwin Encarnacion when he played for the Toronto Blue Jays. He came back from an injury and then mentioned cortisone injections. I was like, it sounds like a miracle needle. So let me tell you, I did my cortisone shot in December, I think 11th or 12th. And literally, like, I was watching them inject it right into my leg. I'm just like, oh yes, I'm going to be healed and I'll be good for like minimum 3 months. But unfortunately, to say this, they actually forgot the steroids inside of it. So the injection and the pain relief was literally just for one day. So yeah, that kind of sucked. But when it happened, like literally my whole right leg, it went numb for a few hours after the injection. But like I said, I felt like I was on cloud nine right after. I started working out. I did a step challenge for work, and that was fantastic. I felt like I was back to normal. Even for that one day, I just felt like I was back to normal. But then right after, a couple days after, I'm just like, oh yes, there is the pain again. The funny thing is, I could have actually won the step challenge, but I had to stop. I didn't want to push the injury. I didn't want to push it further. The hardest part of being injured is not being able to participate in certain activities. I like to go for long runs and bike rides, but not being able to really has been frustrating. I've been seeing a lot of runners and bikers and hikers and all sorts of people being active, like especially on the street when I go driving, or when I go for a simple walk. I'll just say the energy or the adrenaline just pumps, and I just want to like just start running and just it's the excitement for me. It's a joy that I had while running. I like running because it helps push my limits on how far and fast I can run. It was a nice outlet to have when I felt stress or wanted to clear my mind. So to have that removed because of the injury, it just sucks. It really just sucks. I was actually on the verge of, prior to being injured, of being able to run a kilometer in less than 3 minutes, which to me, I think is fast. It was like, I just went and I kept pushing and going faster and faster. And it was just really just how far I could go, how fast I can. So I was literally just sprinting for a kilometer, like straight without stopping. And literally like right after the kilometer, I didn't feel tired. I was at that point. I didn't feel tired. I was stretching. I was working out. I was swimming. I was strengthening my legs and bones. And I really was very proud of myself at that point. And then when injury hit, it was just like, oh, I can't do it no more. Then COVID hit. Then it was just like, okay, if I got better prior to COVID, then I'll be able to participate in running events. But now they shut that down. So I don't know what's going to happen with all the running events. It's going to be quite interesting. My weight. So for the past few years, I was at like 171. I gained, I went up to from 171 to 193. So I'm almost like 200 pounds. I'm just like, it's all like stomach and butt. I've noticed my face actually got like fatter, and it's just not me. However, I can't blame the injury on it, because I strongly believe that eating right does play an important role in weight loss and maintaining. I just believe that I lost that motivation. I didn't want to injure myself. Even worse, because I became careless. I became lazy, to tell the truth. Not being able to do those fun things. I guess I was a little depressed. Again, frustrated. It's like 8. I didn't work out as much as I used to. So I'm quite disappointed in myself in the past few years. So hopefully after the surgery, I'll be a lot better and back to motivation and back to pushing myself. Anyways, after the surgery, I have to be using crutches for 6 weeks, which would be interesting. And I have to do 6 months of rehab. And when I think about like being on crutches, it's another obstacle. I love the fact that I'm being challenged by this. So it'd be awesome to see myself conquer it. And anytime I think of rehab, I think of people trying to walk again between those poles. And everyone's motivating them to not give up and try again. It reminds me of the running events where people have signs to keep going and don't give up. My favorite of those are those people that yell out your name because your names are on the name tags in front of you, and they're like, hey, keep going, like you can do it, you're almost there, 5 more kilometers. And there's people that like have signs like high fives for power ups. So yeah, I miss that about the running events. It's also nice that I have a friend that went through something similar, and to hear their story and journey, it keeps me to have a different point of view and a different mind frame and a different outlook on it, because they went through a lot of injuries and a lot of surgery in regards to this. So I hope you're hearing about this, and I really hope you're going to be. I believe that you're going to be on. Well, my friend that had all these injuries, I believe that they mentioned that they want to be part of the podcast. So to hear their journey will be quite interesting as well. Overall, I am excited and nervous to go through this. However, I'm going through this with 100% confidence, 100% focus, 100% positivity. This will be the biggest challenge, and I'm ready to face it head on. So, subscribe, send me those comments, like and share. I'll be doing some episodes of the journey through the podcast, but just to see how I am doing after the surgery and probably going through the crutches, and also going through rehab, just my mindset and really just what I went through. But any videos for post-surgery, so the workouts and just my progress, I have another channel. It's called Chainsaw Phoenix. So this is Chainsaw Phoenix, heading to the exit.